My name is Mike Neafsey. I am the One Health Coordinator for APHIS Veterinary Services. So my office is the Office of Interagency Coordination, and we have many portfolios. We typically engage with other federal agencies to identify mutually beneficial solutions to overlapping mission areas. We work with stakeholders, both internal and external to USDA, to identify tools, to look at programs, technologies that all support the APHIS mission. So our office is in charge of creating the strategy and policy around many different portfolios, some of which are highlighted on the slide up here. Our team is very highly specialized and extremely diverse. We have a lot of different, very interesting topics up here, but we have everybody from environmental engineers on our team that are focused on some of our efforts after depopulation, working on composting. We have veterinarians working at the World Organization for Animal Health, or WOA, as well as FAO. We have our emerging disease coordination that also runs from our office. AMR, a lot of, as you see, many of the issues that are highlighted up there, but everybody is highly specialized on our team. We tend to touch each of the APHIS mission areas, and we work to coordinate across all of the APHIS programs. So One Health, all of us have an idea of what One Health is. For us, it's not just a mindset. It's not just a philosophy. It's really our approach. It's what we're doing. The National One Health Framework, which was published in the Federal Register in September 2023, defines One Health for the U.S. government as a collaborative, multi-sectoral, and transdisciplinary approach with the goal of achieving optimal health outcomes that recognizes the interconnection between people, animals, plants, and their shared environment. And so one of the things that is very important to APHIS is we are really focusing on that interconnection between animals, plants, environments. And with that connection, we have an obligation to act. It's not just something that we can say, oh, we're going to use the One Health approach. We have an obligation because of our many mission areas to act with that in mind. So some of the different USDA priorities. So just to explain how this sits, USDA is our department, kind of our larger umbrella. Underneath of USDA, we have APHIS, so Animal and Plant Health Inspection Services. So these are some of the priorities for USDA, the larger department. And we have zoonotic disease engagement, investigation, and response, antimicrobial resistance, pandemic and animal disease preparedness, and food safety. And with those items in mind, we created an APHIS One Health strategic plan. And so here are the 4 goals for the APHIS One Health strategic plan. This is something that was just finalized this year, and we're actively working to develop metrics for success, as well as how we want to operationalize this plan across the APHIS programs. So who within APHIS is responsible for point 1? Who is responsible for point 2? We're still working out a lot of those things to operationalize. But we see ourselves working over these 4 goals over the next 5 years, and that is protecting against current and emerging diseases and pests that threaten animal, plant, environmental, and public health, promoting biodiversity and facilitate adaptation to and mitigation of the impacts of climate change, fostering innovative strategies, research, and methods development to support One Health goals, promoting One Health education, recruiting a diverse workforce that's cognizant of One Health and climate change issues, as well as training the existing workforce on One Health issues. So when you think of APHIS Veterinary Services, anybody who is familiar with our program, you may think of some of our more traditional animal health programs like tuberculosis or brucellosis. And this slide has outlined some of the examples of VS's, or veterinary services, traditional roles as compared to our broadened One Health roles. So today, APHIS Veterinary Services plays a key role in addressing One Health issues, bringing our expertise in animal husbandry, animal health, ag production systems all to the table to help out with that discussion. So what we do is we're constantly coordinating with our public health partners and other agencies to develop integrated infrastructure for detecting and responding to zoonotic disease. We leverage our partnerships to coordinate and incorporate animal health perspectives on the ecology and epidemiology of agents that affect animals, people, and their shared environment. So some of the other things that beyond tuberculosis and brucellosis that we regularly will coordinate on are things like rabies, bovine spongiform encephalopathy, or mad cow BSE, many names for that one. Enteric zoonosis, so we're looking at salmonellas, E. coli's, as well as animal influenzas, so primarily swine and avian influenza. So additionally, APHIS coordinates with CDC to investigate illnesses of zoonotic disease using the One Health approach. And a really great example of that is what we just came through with SARS-CoV-2. You know, that was a big thing, COVID in people, but we also had a high number of investigations related to animal cases. Okay, so I'd mentioned tuberculosis and brucellosis on the last slide, and want to make sure to highlight those because that's really what started One Health for our agency. And when I say One Health, we didn't, you know, this is 100 years ago. We weren't using the term One Health in there, but we were really sitting down with our state, tribal partners, public health. We were tracing back whenever a person was getting sick or was exposed to one of these agents. And so we would not be where we are today with either one of these diseases had it not been for the One Health approach. And so where we are, I guess, for those of you in the room that are not familiar with tuberculosis or brucellosis in animals, we have a very small number of wildlife species that are hosts in a very small geographical area. So tuberculosis we see in the Michigan area, brucellosis we're seeing some in the Yellowstone area. But again, we would not be where we are without that One Health approach. And I guess going backwards, one thing, we're not done with this. Like, this has not been eradicated. Yes, it's gone down to a small number of species that are impacted in a small geographical area. If eradication is possible, if that's on the plate for us, then we need to continue to use our One Health approach if we're going to be successful. I don't see us being successful USDA APHIS alone in this. No, that's not how it's going to work. It's going to be all of us continuing to be at the table to see this all the way through. So AMR, to address gaps in antimicrobial resistance related to animal health, we've been working in 4 primary categories. So antimicrobial use and stewardship monitoring is primarily done through systems that are conducted by the National Animal Health Monitoring System, or NAHMS. And that is using a representative study design. And what it's working to do is provide national estimates of antimicrobial use and stewardship, as well as collecting some other animal health information. We then have the antimicrobial resistance monitoring. So NAHMS collects antimicrobial resistance data from healthy animals, but we have the National Animal Health Laboratory Network that have projects to evaluate antimicrobial resistance in animal pathogens. And they're collecting samples from sick cattle, sick pigs, sick chickens, and they are using their well-established network to support those projects. Third is education and outreach. So we have the National Veterinary Accreditation Program, which is providing freely available modules online to educate veterinarians about antimicrobial use and stewardship. And then the fourth is collaboration with industry and university partners. And we are engaging in several collaborative projects to better understand antimicrobial resistance in animals. And we're partnering with veterinarians to look at trends in use and resistance, and working with academic researchers to try to improve some of the sampling that's going on farms. So we can all agree antimicrobial resistance is a One Health challenge, and it really highlights the interconnectedness of people, animals, and their shared environment. Now, historically, we've focused on livestock as a source of resistant infections in humans, primarily through food. Now, as we look into the future, APHIS has been expanding our One Health portfolio, and it's including work in wildlife and in companion animals. So wildlife scientists at APHIS National Wildlife Research Center are developing AMR bacterial diagnostics for wildlife and conducting experiments in field studies involving a number of species to determine the potential for transmitting disease to livestock or to crops. And so NWRC, or National Wildlife Research Center, has identified multiple wildlife species, such as raccoons and gulls, European starlings, and there are a number of others that really are hosts that can move AMR across wide areas, and in some cases across continents. So that's a pretty big issue that we are going to be tackling over the next couple of years. Companion animals. USDA Animal Care, they're actively working to create educational resources for dog and cat breeders and brokers that may be using antimicrobials, and trying to talk to them about use and stewardship and appropriate disposal, many of the issues that they would tackle. But Animal Care is under the Animal Welfare Act, would be the primary APHIS group that would interact with those folks. Crops. So APHIS is supporting research on how antimicrobials are being used in crops and addressing issues like citrus greening disease or fire blight in apples and pears. And they are working to expand in that area as well. All right, so I know we're here to talk about climate. And I just want to acknowledge, SARS-CoV-2 is what we've got up on the screen today. But I think that this is really just kind of the tip of the iceberg when we're looking at emerging disease issues. We're going to see opportunities for more interaction between wildlife and livestock, wildlife and people, livestock and people. And that all comes with climate change. Anytime we see increases in very large tornadoes or a flood event, just like what we just did with our activity during lunch, issues like that are going to draw animals and people closer together. We're going to see opportunities for emerging diseases pop up more and more frequently. So I anticipate this is the public dashboard, what you can find on the APHIS One Health website related to our work with SARS-CoV-2. I anticipate us sharing more of this type of information as future emerging diseases pop up. So we all know about HPAI in cattle. Many of us have been following that very closely, and we are working to share that information very similar to how we did with SARS-CoV-2. I want to point out that information collection and sharing changed significantly through the course of this particular outbreak. And what we've recently put up is a lot of our variant-related information. You'll see on the next slide. Variants as it pertains to the human cases. So what we tracked with our public health partners was, a particular variant would spike in the human population and then start to come down, and the animals would track very closely to those spikes. So we were seeing opportunities for spillover and potential, in some cases, to spill back from people to animals. All right, so SARS-CoV-2, I'm going to go through a couple different projects that we are supporting, but I want to make sure that everybody's thinking about building connections and opening up different surveillance streams. Like, how can we learn from one another? And a couple of these projects, particularly the one that's on the screen now, this is a non-regulatory, we don't regulate mink the same way we do poultry or cattle. But we were able to build relationships with university partners and a very new and unusual industry here. So in the middle of 2022, we launched the mink SARS-CoV-2 Transmission and Avoidance Monitoring Plan. I'm going to call it mink stamp because it's way too long of a name. But we linked up with researchers from the Ohio State University and Fur Commission USA, and we approached 18 different mink producers in six states who volunteered to be a part of this. They collected 250 oronasal swabs weekly for a total of over 85,000 samples and 250 serum samples monthly for over 19,000 samples. Now, we were tracking SARS-CoV-2 very closely. We wanted to make sure that mink farmers were not bypassing their state animal health officials and just saying, well, we're a part of this project. I'm not going to tell you if my mink got sick. we made sure to slow the process down to, reiterate that if your mink happened to be sick during the study period, you still were obligated to work with your state animal health official, your state public health veterinarians, to let them know exactly, what was going on in your farm so that they could take appropriate action. Our study was off on the side, but no clinical disease was reported amongst the participants, and producers were paid for their time. Ohio State University tested all of the samples, all of the serum, and that helped us to focus in on what samples and what timeframes we wanted to take our PCR testing from the swabs. And then from that, we took everything over to the National Veterinary Services Laboratory for sequencing. Now, we should have this study published here soon. We have a couple more areas that are still under investigation around reinfection and virus circulation. But again, this opened up a surveillance stream for us. Now, we did it the wrong way. And how I want to say that is this was done during a non-peacetime. We opened up a relationship and a surveillance stream during, a time where we were being told or being asked to respond to this particular public health crisis. In my opinion, we really should have built that relationship early. We should have already had those surveillance streams opened in some way and had the opportunity to ramp it up. Now, this was a very unusual circumstance in mink farms, but, I ask all of you to take a look at, who are the partners that you're working with? Do we have any of these smaller subsets of, a crop grower that you might, only interact with once or twice a year? For the animal health side, do we have any industries like the mink industry that you can approach and work with? I encourage you all to look at those and really think about how we can build those relationships and build out our surveillance streams, if necessary, as early as possible. Two other projects that I'll highlight again. These are projects where we had a peripheral relationship associated. It was more of a regulatory-based relationship and not the non-regulatory based relationship that we had with the Fur Commission. This one, USDA APHIS Animal Care, works a lot with the zoo and aquarium groups. So we have two very similar projects. The zoo and aquarium serology study enrolled 60 facilities, various sizes around the country, all volunteered to enroll. Those facilities had three different projects that kind of coalesced as one. The first was a banked serum sample, and that was collected. Hope I don't get this wrong. There is a sample that was collected from the animals pre-COVID. There was a sample collected from the animals during COVID. And then if the animals were vaccinated, a sample was taken post-vaccination. There was also a biosecurity assessment that was completed associated with this project, where we had an APHIS official go onto the site and look at some of the vulnerabilities, talk to them about their biosecurity plans. And these, again, are zoo and aquarium. So, we're not our traditional species, we're talking livestock. And this was a very different type of stakeholder that we were approaching here. So we had 60 facilities that enrolled. 27 of those facilities allowed APHIS Wildlife Services to go on site and conduct some of the peridomestic species sampling, looking for SARS-CoV-2 in, say, a wild raccoon, chipmunk, that kind of thing, all around the zoos and aquarium. The wildlife rehab study, which is also highlighted on the screen here, was very similar. Rather than doing an in-person biosecurity assessment, there was a brief web questionnaire associated with it. There were some banked samples that were tested, but most of those are swabs that were collected during the studies. We had a couple more or a couple less facilities associated with that project, 60 for the zoo and aquarium, 50 for the wildlife rehabbers. But again, the importance of the last two slides for me are we need to look at the available surveillance streams, look at some of the folks that may be on the periphery. For APHIS Veterinary Services, we are traditionally livestock focused. The last two slides, mink, and then zoo and aquaria, wildlife rehab, that isn't our bread and butter. That's not where we spend the majority of our time, but we have opened up those relationships and asked, where we have mutual objectives, where we can learn from one another. They can use our animal health and animal husbandry expertise, and we can use their expertise in zoo and aquaria medicine, zoo and aquaria, just a very different world from what we're used to. So again, I encourage you all to take a look at those around you and ask where you all have overlapping and mutually beneficial objectives. The next, so for many years, APHIS Veterinary Services has supported the testing for foreign animal diseases. Now, we're fortunate that many of those tests have come up negative. I'll knock on wood. But one of our issues that's plagued us for many years has been, okay, it's not foot and mouth disease. It's not African swine fever, you name the foreign animal disease, but what is it? And we just haven't been able to really dig in and figure out what the issues have been over the years. So what we did was thinking about an emerging disease issue. Again, emerging diseases very likely to come up with climate change. We're thinking about more interaction with wildlife, more interaction with animals in general. So we're going to see the opportunity for emerging disease come up more frequently. So we are supporting a project that we call the Unusual Morbidity Mortality Event Project. And we're working with the National Animal Health Laboratory Network to fill in some of the gaps. So, okay, we figured out that it wasn't this foreign animal disease. And now what we're doing is we're working with the lab network, with the veterinarians, with the producers to fill in the gaps of what is it. So this isn't designed to support routine diagnostics, and it's not designed to replace our foreign animal disease diagnostics that we're doing on a regular basis across the US. But rather, asking these questions that are up on the screen to get into how can we support this with advanced diagnostics? Where are the gaps here? We have a vesicle in a pig. It's not foot and mouth disease. It's not African swine fever. But what's in that vesicle? And after the routine diagnostics are completed, after we figured out it's not a foreign animal disease, that's where this project comes forward. And we see an opportunity for us to expand this in the future, again, because emerging diseases are going to be coming up more and more frequently with climate change. So one of the projects that we did, or one of the areas where we did support with this particular project that made the news that some of you may be aware of are the unusual canine morbidity mortality events that happened earlier this year. So this was one where we supported a good bit of diagnostics through the NOM labs with that particular event. All right, now I can't escape the room without addressing the elephant here. So the current HPAI situation, and it was discussed a little bit with our public health partners earlier. I believe it was from Pittsburgh. She had mentioned and showed some CDC data that had pulled directly from the APHIS website. But right now, actually, my numbers are incorrect here, so I just want to acknowledge that right off the bat. Our website gets updated at 4 p.m. every day, but what I saw this morning was 126 premises in 12 states, not 115. So just based on when I had pulled the data for these slides. So I just want to acknowledge what you might see on our web may not reflect what's in the slide today. But this is an example of an emerging disease issue that's crossed species lines, that has rapidly expanded and is now really taking a significant amount of our focus and amount of our resources to respond to this. So really, this could be an example of what we would expect to see with future emergent disease issues. So we're going to take lessons learned back from this and be able to reflect on what's worked, what's not, how we can work better with our public health and environmental health partners to look at taking a full One Health approach for emerging disease issues. But general summary, for those that are not following the Moo Flu, March, APHIS was alerted to by the dairy industry and state animal health officials in Texas about reduction in milk in second lactation cattle. Now, this is a very specific subset of dairy cattle. And initially, honestly, we were thinking that this was looking like a dietary issue. There were a number of wildfires in that particular area. This is a very specific subset of the production in the dairy system. And so, yeah, it was looking like a dietary issue because we were seeing only the lactation drop in that particular subset. And then we had late March, March 25th, we had the finding. And everything has changed since then. So we work extensively with FDA and CDC and state veterinary and state public health officials to investigate detections of highly pathogenic avian influenza in lactating dairy cattle. Not just second lactation dairy cattle anymore. I want to point that out. It has expanded from there, but the initial call out was for a very specific subset. So APHIS is using its website to maintain resources, including our list of detections. You'll see our map that we have published online behind me. You'll also see biosecurity information for farmers, for veterinarians, and for farm workers. All of that is located on the APHIS webpage. In addition, you're going to be able to find research updates, FAQs. You'll find our EPI studies. We have a lot of information about this particular outbreak online. And just so I can kind of give the caveats here that I need to, no concern about safety of the commercial meat or milk supply. So you guys can just take the stress level down a little bit. Pasteurization is continuously proven to inactivate bacteria and viruses like influenza in the milk. And APHIS continues to maintain a robust system that's designed to mitigate the spread of animal diseases, therefore protecting public health and maintaining safe food supply for domestic and international markets. We'll get away from the elephant in the room here. Oh, wait, no, we won't. So I just want to point out a little bit about what we've done in the field. So like I said, we have the EPI studies that we've done. And I just want to point out that we have worked through voluntary participation to gather a lot of this information. We have questionnaires that have gone through the state animal health officials or through some of what you'll see on the bottom there, epidemiology strike teams. We've supported APHIS personnel to go out and deliver and support these investigations. We have intensive sampling that's going on in farm. Again, that's voluntary at this point. But sampling is ongoing in many states at this point. We've also worked very closely with APHIS Wildlife Services to conduct peri-domestic species sampling on and around many of these dairy prems. So I encourage you to take a look online, take a look at some of the EPI information that's associated with this particular outbreak. It's all online and it's changing very rapidly. Our numbers are updated at 4 p.m. every day. So if this particular one is of interest to you, and many of the people in the room here, it is, but just want to acknowledge that this work is all available online. So taking a little bit of a left-hand turn from animal health and the heavy topic of HPAI, just want to touch on the great work that APHIS Plant Protection and Quarantine does. And they touch quite a bit on the climate change front here. So from the former PPQ deputy administrator, I have a quote, and he said, "Plants provide more than 80% of the food we eat and 98% of the oxygen we breathe. Our lives simply depend on plants, and that's why plant health matters." Looking at this another way, the majority of the world's soybeans are fed to livestock. So plants are an essential component for all other parts of the agricultural production system as well. So PPQ, what do they do? They're using pest risk analysis to focus on introduction and spread of pests and the potential impact that might have. Now, we heard earlier a little bit about vectors, but vectors, we can consider other pests in there as well. As climate change happens and it impacts different geographical areas in different ways, we're going to see movement or expansion of pests into new areas. We're going to see expansion of geographical distribution. We're going to see that change over time as well. PPQ has a strong pest surveillance detection and response program and provides a number of checks associated with pre-clearance programs, import inspections, as well as surveys in rural and urban areas. And they're using geospatial analytics to assist in targeted surveillance, resource planning, and response activities. And they also are conducting climate suitability analysis. All right. So PPQ, Plant Protection Quarantine, plays an integral role in One Health through its modeling systems that forecast plant pest risks. So they partnered with NC State to create a modeling system called the Spatial Analytic Framework for Advanced Risk Information Systems, SAFARIS. And this is a web-based framework that incorporates historical and current weather data, and then plus pest biology and other factors to create predictive models for plant pests. Now, they also have, it's what they'll see as SAFARIS PetCast, which is the one on the left, that's using real-time data to create 7 and 30-day predictive models or forecasts for the start of adult emergence and then post-adult emergence for different pests. And you can use a specific location and track it all the way down to, let's say North Carolina, and you want to look at specific areas in North Carolina, you can track that information using that system. And then we also have the Cooperative Agricultural Pest Survey, which is a program that conducts exotic plant pest surveys through a national network of cooperators and stakeholders. They use the maps through SAFARIS, and then that's used to support their planning and prioritization for where pests may establish. So what we're all here to talk about, climate change. So again, APHIS is recognizing climate change presents a threat to its ability to complete its mission as we've written it out today. We don't anticipate that we're going to have a big modification in our regulatory frameworks, but we do think that there will be a need for new regulations and policies, as well as innovative non-regulatory approaches to address shifting conditions. So in addressing the climate impacts, APHIS has really put the focus on 2 strategic goals. The first goal is safeguarding American agriculture. The second is facilitating U.S. agricultural export. And we've determined that those 2 particular goals are threatened by a decrease in agricultural productivity and then shocks to the system due to extreme weather. And we're expecting this to become more and more frequent. We all have had this discussion today. We're going to see disruptive events. We're going to see hurricanes, floods, tornadoes, all of which can have significant impact on the agricultural system. So again, with the shifts in climate and the extreme weather, we're going to see pest populations shift to new or expanded habitats, and you're going to see the increase in spread of disease. Something like citrus greening is a prime example of that. You're going to see other pests as well as encounters with wildlife in populated areas, and you're going to see things like avian influenza. I hate to use that one as the example of the day, but if we have more interaction with wildlife, you're going to have the opportunity for people in urban areas that may not, have seen geese in their backyard. Now they do. Now you have them swimming in the pond directly in the park that they play in. Those spillover opportunities are going to become more and more frequent. So we've published the APHIS Climate Change Adaptation Plan. I realize that the screen here is very busy, but it's just a screen grab of a document that if you're interested, I'd ask you to go online and go ahead and take a look at. But the document highlights some of our agricultural climate vulnerabilities, as well as our progress metrics. So we're working to update this document, and we hope to have something out sometime early next year. All right, so collaborative efforts. I can't leave here today without acknowledging some of the collaborative efforts that we have. We work a lot with different government agencies. As I pointed out, I come from the Office of Interagency Coordination. So just in the title, it's kind of implying exactly what I'm about to talk about. But, we work in partnership with CDC, FDA, EPA to allow us to coordinate response to zoonotic disease, as well as environmental health threats. And we have liaisons sitting in multiple government departments to help us stay connected on a daily basis with others and help us really grow our connections to make sure that we are taking and embracing this One Health approach, and we're not just saying it, but we're doing it on a daily basis. So on the global scale, like I pointed out, we're working with WOA, World Organization for Animal Health, FAO, PAHO. We have NPAPI, which is the North American group that talks about animal health pandemics. It's expanded its scope here recently to now take on all animal health risks. But we're also partnering with universities, partnering with different nonprofits to ensure that our policies and interventions are grounded in the most recent science that we can find. We have joint research projects. I highlighted one, with the Ohio State University and our mink stamp, and that's again opening up different surveillance streams and hopefully staying ahead of future potential threats. All right, so the next couple slides here, I have taken as a part of our One Health coordination unit. So these were created as a partnership with CDC and Department of Interior. So I can't claim ownership of these ones, but I will have the opportunity to speak on their behalf. So back in 2017, the U.S. Disease Prioritization Workshop called for a National One Health framework to basically look at how we're coordinating around zoonotic disease. So it was followed up in 2021 from a call from Congress to do the same thing. So that call from Congress kind of lit a fire under everything. And since 2021, we've been really working hard to get this framework pushed across the finish line. And so again, CDC, USDA, DOI built this particular framework. You'll see it's a 5-year framework. It describes the common mission and goals, defines our touch points with non-USG or non-US government partners. But then it also describes an operational arm. So we have what I call the OKU, or the One Health Coordination Unit. And that's really setting the goals and providing the working group platform for sharing One Health information over the next 5 years. Mission and vision, I'm not going to read this out loud to you, but this is a part of our National One Health framework. This is for US government only. Now we can have our state, our university partners, our nonprofit partners adopt something similar to this if you'd like, but this is just where USG sees themselves in the One Health framework. And then we have multiple goals here. So goals 1 through 4, there are 7 goals total. So the goals for the National One Health framework, we have coordination, collaboration, communication, prevention, preparedness, and then outbreak investigation response. The first 4 goals here are really, what are we going to do with an emerging zoonotic disease? We are going to have coordinated investigations. We are going to have a high level of communication around these things. The middle 2 goals, so goal 2 and 3, prevention, preparedness, is kind of exactly what we talked about during our lunch exercises is, what do we need to prevent this from getting worse? A lot of times it's going to be really difficult to completely prevent, take the risk to absolute zero. I just don't see that as being an honest goal. But what do we do? Well, how do we take it from going at the local level to going to a regional or going to a national level? Those kinds of things are what this particular platform will use to prevent or prepare for those kinds of incursions. Goals 5 through 7, we have surveillance, laboratory. I kind of lump those 2 together because I don't think we can have adequate surveillance without having a really strengthened laboratory network. And then the last one, and we had kind of highlighted this earlier in the talk, was just supporting a One Health workforce. And that is, hiring a diverse workforce that's equitable and inclusive of One Health, training existing workforces to, understand what this approach is. And when I say, using the One Health approach, I don't mean just coming to the table and acknowledging we have plant health, we have human health, we have animal health. We check the box, that's One Health, we're good. It's really a challenging thing. And it's not something that, we can keep folks at the table, or we have to get folks to realize the value that they bring to the table and what they're advocating for and a reason to stay at the table. It's easy to get somebody to come, but it's harder to get them to stay. So this is part of that, growing that workforce that's used to these types of challenging conversations. So right now we have 24 different federal agencies at the table for this particular effort. And I'd be lying if I said, getting all 24 to agree on one objective is an easy thing, or, that it happens regularly. It doesn't. But again, using this One Health approach, we have a platform to come to the table to talk about things that we can agree on moving forward as a U.S. government, things that we can agree, but there are some challenges with Department X, Y, and Z. This is a platform to share information. And so again, we have 24 different federal agencies at this effort. National One Health Framework itself is in the final stages of the clearance processes, and we're really hoping to publish this information in a final report on the Federal Register by the end of the year. And OCU, so the One Health Coordination Unit, just to let you know, it was stood up earlier this year. We're currently working to develop our goals and objectives and our work plan for the next couple of years. So this effort, while it's been going on since 2021 and call from Congress, we've built this framework. The operational arm is still very much in its, what I'll say, it's infancy. And we've got this thing up and we've got it moving, but we have to build momentum. And we also have to acknowledge the great work that others are doing and ways that we may be able to touch those programs. We can't pretend that US government is going to take the One Health approach alone here. We aren't the sole answer. So we're actively working to engage with state partners, nonprofit partners, university partners. So take a look out for the National One Health Framework later this year. That should become public for you. And that is all I have. So I will open it up to any questions, comments, or concerns.
Thank you. Just wondered, is there any focus at this point on, in the interest of safeguarding food supply, et cetera, to focusing on herbicides and pesticides such as glyphosate and the other similar products that are little health endangering? Is there any focus on those? I guess we're trying to do a balancing act here of maintaining a healthy food supply. At the same time, some of the products we've used are turning out to not be such.
Okay, I believe I understand the gist of your question. Are we looking for, let's say, safer alternatives? Would that be fair? And this is an issue that we're in constant coordination with our other USG partners, FDA, EPA, looking at local impacts as well. So we'd be working with state animal health officials, state public health veterinarians. I can't speak to any specific research. A lot of our research happens through the Agricultural Research Service, but I'm confident that they'd look at issues like those. And I say that because one of the issues that was a priority for the department was around food safety, and those issues would come up as a part of that particular umbrella. So I can't speak to any specific projects related to that, but I know that sustainability and those types of issues are being addressed.
We have one question online. The issue of training and data integration, how is that being addressed? It is common to see agencies accumulating data on viruses and other pathogens, but with limited expertise in analysis and record keeping. Plus, such facilities are far too expensive, so require some coordination.
So how are we addressing that?
That is the question.
Okay. So the One Health Coordination Unit and the National One Health Framework would be an opportunity for us to look at surveillance data and how we can integrate to share information. One of the things that we're actively working on is a tool that has been put forward by the WHO, the World Health Organization. It is the 2024 Joint External Evaluation Tool, and we just wrapped up that effort this past week, actually. Yeah, Friday, 5 p.m., submitted that document. And it looks at U.S. capabilities for surveillance, for detection, for response. So some of the questions related to U.S. capacity on that particular effort were about data integration and about, how successful we are at that. And in going through that exercise through the WHO, we're finding that we have a lot of opportunities for improvement. And I think the work that the National One Health Framework and One Health Coordination Unit will really help to speed up the way that the U.S. government is collecting, sharing, analyzing data. And so I'm saying that there are a lot of opportunities for success here in the future, that we're not there yet. You know, like I can't say that we have 100% access to data streams collected from Delaware with the same confidence that I can say about Missouri, Oklahoma, you name the state, everybody's going to have half a dozen, if not more, data streams that are in there. So to say that we have access to everything, no, we probably don't. But you know, we're actively working on improving our systems, and we're doing that not only at the USDA, not only at USDA, but across the US government through the OCU.
Thanks. Dr. Neafsey, I'm curious, because it's such a broad topic and all these federal agencies are working together, do you foresee all these programs in this framework supporting jurisdictions at the state and local level to, try to focus on a One Health initiative? So a lot of programs, either public health or ag at state levels, they have specific, usually specific funding initiatives, but because it's diverse, are you expecting to see this type of framework moving down to the state and local level, especially funding wise, resource wise?
So one of the things is this particular effort is not funded at this point. So this is, going at the USG level unfunded. And we were very careful to not dictate work to the state or local level. So we didn't want to tell you at the state or local level how to do your jobs. And so we didn't want to give a framework that may be counter to the work that you're already doing. So we opened up opportunities for touch points, but we're also actively exploring that funding question. When we put it out on the Federal Register for comment, the National One Health Framework out on the Federal Register for comment, secure funding was probably one of the top comments that came forward. So we're actively engaged working on that particular area. And as this effort matures, I think there is the possibility for looking at exactly what you're pointing to there. But again, we were very careful not to dictate the work down, but to create touch points for you to use your own framework to say, okay, this is how we may be able to coordinate with the USG effort over here.
What do you see as the future of One Health? How will One Health USDA coordinate with wildlife and aquatics?
She's going to try to throw me the softball one. Thank you there, Dr. Driscoll. So how can we coordinate with wildlife? I don't think that we can really move forward using a One Health approach without really incorporating wildlife. I mean, we talk about encroaching in different habitats with climate change. The wildlife will always be one of those things that's a part of that conversation. I think if they were excluded, we couldn't really say that we were using a true One Health approach here. As far as U.S. government activities, we have APHIS Wildlife Services that are working with the state and local levels on many of the wildlife activities. A lot of those are kind of by request per state. So it can be challenging on the types of issues that are addressed, but we're working very closely with U.S. Fish and Wildlife, USGS, Forest Service. So we do have a fair number of folks that are at the table that are addressing wildlife related issues at this point. So yeah, excited to see where we go with that particular topic. But again, I don't think, given climate change and given the potential for emerging disease issues, I don't think that we can say that we're using a true One Health approach without having our wildlife colleagues at the table with us.
Awesome. Thank you. And one last question from online. Again, thank you for your presentation, dedication, and keeping us all up to date. As a small animal veterinarian, are there any updates or information regarding HPAI transmission in barn cats?
I'll just hang my head for a quick second. Just cats. Whew. We do have a bit of information on the APHIS website related to cat findings, and that has been a recent addition to the APHIS Veterinary Services websites for HPAI. So I wish I could pull it up behind me and show you, but the wildlife detection on the mammals page where it has the map, it can show you exactly where that information is. We also have a number of resources that are being developed between USDA and CDC talking about interaction with cats, information for veterinarians, information for farm workers. And so we hope that a lot of this information will become available if it's not already available online.